Uh, you're working in a community mental health team.
Yeah,
Sorry, which book is this?
this is Maudsley.
Maudsley.
Yeah.
Okay, I would advise try to practice from SPMM.
Okay, I wasn't aware of this, so maybe
Okay.
next time. Yeah.
Yeah, try practicing from SPMM. Okay.
Okay.
45-year-old man referred by GP for difficulty coming to terms with some of the experiences whilst on a tour of duty. Okay, take a history in order to arrive. All right. Okay, both of you ready?
Yeah. I
Yeah.
can see you, Diamond.
Can you see me?
Yeah, I can see you now. Yeah.
Okay.
Okay,
Yeah.
both of you ready?
Yeah.
Okay. Enter the station, do your task.
Hi, Jim. My name is Nayab. I'm one of the doctors from my team. You have been referred by your GP to talk about some of the difficulties that you are having lately.
Yes, that's true. Thank you for seeing me, doctor.
Mm-hmm. So, would you mind telling me, in your own words, what problems are you having at the moment?
I'm having difficulty with sleeping.
Mm-hmm. Mm-hmm.
Yeah.
Um, how long has that been going on?
For about 6 months now.
6 months. All right. Okay. And what is the difficulty with sleeping about? Is it about going to sleep or staying asleep?
Staying asleep, doctor.
Okay. Okay. What happens? Would you mind elaborating it a bit?
Well, I try to go to bed around 8 p.m. at night.
Mm-hmm.
And by 10 I'm still awake. And then I sleep off, let's say around quarter to 10, between quarter past 10 and half 10. And
Mm-hmm.
then by 2 in the morning I'm awake, and that's it. I can't sleep again until the next day, really.
Right. Okay. It must have been really difficult for you not being able to sleep well.
No, yeah, it is difficult, yeah.
Mm-hmm. Mm-hmm. So you mentioned it started 6 months ago. Did anything
Yes.
happen 6 months ago?
Yeah, that was around 6 months ago. I had a difficult encounter while I was on assignment.
Okay. Right. And when you say when you were on assignment, what does it mean?
Yes, so I was in the military and we were assigned to Helmand province in Afghanistan.
Mm-hmm.
And while we were on duty, one of
Mm-hmm.
my colleagues, he was working with two other ladies, and they stepped on an IED, and yeah, the rest is history. It exploded.
I'm really sorry to hear that. This must have been a really horrific encounter to experience.
Yes, it was. Yes.
Mm-hmm. So the sleep difficulty started after you experienced this.
Yes.
Okay. I'm wondering, because it was such a difficult thing to experience, has it affected you in any other way apart from your
Uh,
sleep?
well, now I'm here, I'm back in England, so I had to resign, because I
Mm-hmm.
wasn't able to continue
Mm-hmm.
working, and yeah, so my finance has been affected as well.
Mm-hmm. I'm also wondering, like, do you some of the things that you can experience after witnessing such a difficult encounter is sometimes people um, feel like they are experiencing those memories again, even when they are in a totally different environment. For example, stay at home or out in the public, they might think that the memory is coming back. Is it something that happens to you as well?
Oh yeah, definitely. Yeah, it is. I do get the memories, it's just like I'm back in Afghanistan. It's like I'm back in where the explosion happened. It's like I'm back, trying to help everybody that was hurt. Yeah, I can see everything.
Mhm. And so with all of these things happening, I'm wondering, how has your mood been lately?
Well, not the best.
Mhm.
I'm a bit irritable. And my emotions are, you know, they're not what it used to be, just up and down.
Okay. Okay. And are you able to enjoy anything at the moment?
Well, yes, I can relax with my friends, but that's about it.
Mhm. Mhm. Okay. Okay. And are you taking anything to help with your mood or to help with this feeling of numbing?
Yeah, so it's more of the emotions that are numb, but
Mhm.
the mood is, I guess, it's just the same. There's nothing
Mhm.
really different.
Mhm. Okay. Right. Sorry, what I meant was, are you drinking alcohol at all in order to help with this difficult experience?
No, no, no alcohol.
Okay. Or any other drugs, illicit
Um,
drugs?
no, no, I do not take any drugs.
Okay. All right. And you said when you go to sleep, you're finding it hard to go
Mm-hmm,
to sleep, and
mm-hmm,
then you wake up at early morning, 2 a.m. I'm wondering, when you are asleep, have you
mm-hmm.
experienced any nightmares at all?
Oh yeah, oh yeah.
1 minute.
I have nightmares. And it's always the same dream, over and over again. I see my friends working with these two ladies, and then it explodes, the IED explodes. Yeah. I have nightmares.
Mhm, mhm. Well, thanks, Jim, for talking to me. From what you have described, the symptoms of not being able to sleep, not being able to go back to work, and um, also the trauma memories coming back and the nightmares. It seems like you have something we call post-traumatic stress disorder. Have you ever heard about it?
No, not really.
Okay, so post-traumatic stress disorder is a type of mental health problem which happens to people who have
Right.
witnessed significant trauma.
Right.
Um,
Time up.
and
Okay. So,
Can I just apologize? I prepared for SPMM. Um, and you had monthly, I think. So I was just reading it, and the tag says the GP referred for something in Afghanistan, and then when you asked me, I said I can't sleep. So I think that threw you a bit as to, okay, where is this coming from? And by the time I realized it, I was like, oh, we've already started.
no, but
no,
then honestly, if somebody is doing the station and knows the whole actor's role, there's no point doing it.
Okay.
Okay. Ideally, you should just know it. You should not know anything. A
No,
month before the exam, you should be just doing random stations. I know you are very far off. When are you all giving the exam, by the way?
September.
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 Yeah, it's still way ahead. But then that you should not be. Even when I started my preparation, I never used to read the actor's role. There's no point because that is the reason you get biased. You should not
Mhm,
be reading right now. If you're saying okay, PTSD, ideally the actor should give the station. Change
Yeah.
it here, bits and pieces.
Yeah.
Now, okay, let's come to the feedback. Okay. Now,
yeah, I
Nayab,
haven't.
you tend to rock a lot.
Yeah, yeah. I think it's something that I do when I'm anxious, and I'm aware of it, and that's why I try to kind of control it in the middle of the station when I became aware of it. But then when I'm focusing, it just, I'm, yeah.
Okay, be very careful because if you're so anxious and you're rocking, it
Yeah.
will throw your station. Okay, have you given cask before?
No, I haven't. No.
Okay. Okay, so be careful about your body language. Now, see, the
Mm-hmm.
thing is, person gave you quite a very simple thing that I've not been
Mm-hmm.
able to sleep. Okay,
Mm-hmm.
you said,
Mm-hmm.
okay, what about the sleep? Good. You wanted to dig further. Is it going to the sleep, or the person is waking up from sleep? That time
Mm-hmm.
was your time where you could have checked why is the person waking up? Is the person having nightmare?
Mm-hmm. Mm-hmm.
Yeah, you really put lots of effort to ask flashback nightmares because you actually didn't know how to ask it. So say that what
Mm-hmm.
okay, what is it which wakes you up? Are you having any bad dreams, any nightmares straight away?
Mm-hmm. Mm-hmm. Mm-hmm.
Okay, what
Yeah.
else? Then you went on the impact. Now I don't understand why you went from straight away sleep to impact.
Mm-hmm.
Yeah,
Mm-hmm.
when you go to a history station like PTSD, what are the
Mm-hmm.
three domains you should be asking questions from?
Well, you want to elicit avoidance. You want to elicit the trauma in first place, and then avoidance, and then
You might not elicit the trauma at all.
yeah,
The person
yeah.
may not be ready to tell you the trauma. Plus, when
Mm-hmm.
you're talking about the trauma, you should be very, very careful. You should say it's a very sensitive question. I'm sorry that I'm asking you to relive those moments.
Mm-hmm.
Patient in PTSD, it looks very straightforward, but most of the actors don't want to discuss the trauma.
Yeah,
Okay,
yeah,
don't be
yeah.
fixated on the trauma. Nowhere it says that you have to elicit the trauma. I'm asking
Mm-hmm.
what are the three domains you should be asking questions from. And suppose you have to take a history of PTSD.
Well,
Intrusion, hyperarousal, and
yeah.
avoidance.
Yes. In hyperarousal, nightmare can be one of them. Okay. So
Mm-hmm.
hyperarousal, what all questions you can ask? Irritability, right?
Impulse startle response.
Just ask two questions from each.
Okay.
Mm.
Okay. And intrusiveness, you can ask flashbacks, you can ask nightmares.
Mm-hmm.
Avoidance. Okay. The person has resigned from the job. So that's a very,
Mm-hmm.
very big form of avoidance. Yeah.
Mm-hmm.
Is she
Yeah.
trying to avoid anything else? Okay, avoid meeting friends who are there. What else is the
Mm-hmm.
person trying to avoid? How has now, when you go to the impact, the person said, I've
Mm-hmm.
resigned my job and
Mm-hmm.
it's impacting my finances. Okay, how is it
Mm-hmm.
impacting your social life? Okay,
Mm-hmm.
is she doing anything? How is it impacting her mood? How is it impacting her family life? Okay,
Mm-hmm.
in any PTSD, you cannot, any history station is not complete if you don't do the differentials.
Yeah.
Okay, mood, energy, appetite, sleep. Okay, is she doing anything at all? Most of the times, PTSD can be comorbid with GAD, generalized anxiety disorder. Do you think
Mm-hmm.
she's always like, do you think you are always anxious or are you always on the edge? Okay.
Mm-hmm.
Many times the actor was prompting you that, I feel very numb. Do you get startled by simple noises? These are the very classic questions you can ask for PTSD. Okay.
Mm-hmm.
Do you tend to relive those moments during the day?
Mm-hmm.
That's what you should be asking because you went round and round.
Yeah.
Many people have experience. They may not have very bad experience. Remember, the trauma
Mm-hmm.
doesn't have to be a significant trauma. That is where people get very confused. Okay.
Mm-hmm.
I know in the diagnostic criteria, it will say significant trauma. But for some people, a simple event can be significant.
Mm-hmm.
For another person, that thing might not, like so many people go to the war. Do you think everybody develops PTSD? For one person, the same event can be very significant. For another person, same event might not be very significant. Yeah.
Mm-hmm.
So each,
Oh.
I mean, this thing is obviously a major event which happened. So how has it impacted? That's all very good to ask. But then ask small, small questions. Short, make your questions very short. That's how you'll finish your station. Okay.
Mm-hmm. Mm-hmm.
Any history is not complete without past history. It's a
Mm-hmm.
history station. Have you ever seen a psychiatrist before? Anyone in
Mm-hmm.
family has mental health issues. How is she coping? Now, question about coping. I felt as if you're asking if she's taking any medication.
Mm-hmm.
Okay.
No, yeah, I wanted to ask about alcohol.
Yeah. So be very careful what questions you're asking because if the actor asks you, Doctor, what do you mean? What do you mean? Twice they ask you, that's it. Your station is gone because of the anxiety. One bad station will also spoil the other stations because you'll keep thinking about that. So make your questions, answers, and everything, not answers really, but your questions very short and precise, what you want to ask. Okay.
Mm-hmm.
How has it impacted your sleep? Okay. She's
Mm.
waking up multiple times. So she's giving you a hint that I'm waking up. What is it which wakes you up? Okay. Are you having bad dreams? You don't need to say nightmare specifically. Are you having
Mm.
bad dreams? Do you tend to see those dreams? You know what happened? How about during the day? That's how you link. This is called linking in cask. And that's where I say it's communication. You don't have to tick box. You have to go as per what the actor is telling you.
Mm.
Okay. You're checking the impact on finances. You should check the impact on all the areas,
Mm.
right?
Mm.
And what else was there? Avoidance. So avoidance was not very clear. Okay, check the family history, check medical history, check past history, everything. Okay,
Mhm.
jumpy, numbness. These are very characteristic feature. Most of the time, they'll not tell you the trauma. If you're asking the trauma, say, "I'm sorry that I have to ask you to,
Mm.
if let me know if you're not comfortable with sharing that experience." You should be able to say that.
Hmm.
Mm.
Okay.
Yeah.
Okay. Any other question?
Hmm.
Thank
Yes,
you.
very important thing is you're saying, okay, have you ever heard of PTSD? Why are you asking that question? Your station is what? History and coming to a diagnosis. It's not explanation of PTSD.
Right. Okay.
Hmm.
Okay?
So
Yeah.
do I just say it like I
Yeah,
think you PTSD and then
yeah,
that's it?
yeah.
Okay.
Why would you say, have you ever heard of this? Your station is then you'll almost 100% certain that you will end your station halfway. You won't be able to explain what PTSD is. Your station is not explanation. Stick to your task.
Mm. Mm-hmm. Right. Yeah.
Okay?
Yeah.
All right. Okay. Thank you.
Thank you
Thank you.
very much.
Bye
Thank
bye.
you.
Thank you
Yeah.
very